Hello, Sarah Jane Meat filling in for Neil on this edition of the Sky News Daily. Now, I host the UK Tonight weeknights, 8 o'clock on Sky News, and I guess we're taking over today's episode to talk about pregnancy in prisons. I'm joined by two guests to ask, should pregnant women be spared jail? In just a moment, we'll be speaking to our home editor, Jason Farrell, as well as a midwife, Laura Abbott, about how safe prisons are for pregnant women. But first, let's hear from some people who have been pregnant while in custody.
My mental health just completely declined after having my son. You don't get no support from staff.
This is Anna, not her real name. She describes her experience of giving birth while being handcuffed to a prison officer, which she calls humiliating.
I had appointments that had been missed, like I had a scan that was coming up that had been booked from the outside. Ended up missing that a couple of times because they never had the staff to take me. Obviously when I went into labour, I had, it was early hours in the morning, I'd pressed my cell bell. This was about 5:30 in the morning. Officer told me that somebody would be with me soon. Nobody came. Pressed it another 3-4 times, nobody came. They only then unlocked me at the same time that they unlocked the rest of the landing. Was cuffed to an officer and said, I was told I wouldn't be cuffed in labour. She told me to be grateful that she was putting me on long cuffs and not short cuffs, which are obviously the cuffs with a chain between, not wrist to wrist.
I got a lot hungrier and they told me they wouldn't provide me with more food and the portion I was getting is all I got.
Susie, again, not her real name or voice, thought she suffered a miscarriage while in prison and went through that ordeal alone.
I didn't eat anything all weekend because I thought I'd lost my baby. When the prison officer opened the door, they came in to inform me that if I didn't get out of bed that I'd be punished. They didn't realise that I was still laying in a bed of blood.
Traumatic beyond words. Incomprehensible, really. Terrifying. Lonely. I had no idea I would even be sentenced. So to be taken to prison at 7 weeks pregnant with my first baby with no idea what to expect, panicking I'd be harmed, that I'd lose my baby or have a miscarriage.
Olivia also said she felt alone when she was pregnant in prison with her first baby.
Just generally feeling trapped with no escape, no outside support. I was literally on my own. And I just feel like it was the most inhumane situation by a million miles that I've ever been in. No one acknowledged the fact that I was actually pregnant, so when I initially went in there, I was just left to it. I didn't eat for 5 days. No one checked, no one came to approach me to say, I understand that you're pregnant. If you need to talk, we're here. And there was just absolutely nothing. My stomach felt sick. I was terrified.
Those three women there talking to Jason Farrell, who joins me in the podcast studio. And we're also joined by Laura Abbott, midwife and academic, who has looked into this issue extensively and has done a lot of research in this area. So, Laura, welcome to you. And Jason, obviously good to see you again. Laura, I just want to start by asking you what the current experience is for a pregnant woman entering a prison.
I think it's a very stressful experience. There's a number of reasons for that. I think we know that many of the women going to prison are serving short sentences. And what I found from my research is often they wouldn't know whether or not they would be able to keep their baby with them until quite late on in their pregnancy. It's a stressful place because you cannot access the same sorts of things that we might access on the outside. When you're pregnant, you can't necessarily order maternity clothes, maternity bras, the nutrition, you have to eat when you're told to eat, and also things like comfort. Those are quite big issues.
Talk to me about the impact on mother and unborn child in prison, going through pregnancy and afterwards as well, even if the baby does come into the world safely. Talk to me about what happens.
There's a lot of fear for women. The women that I spoke to in my research all talked about how scared they were, how frightened they were about not being able to get out in time. There are, many barriers to getting out of prison when you're in labour. And that is one of the issues. So women would often feel quite scared. They would talk to me about how they would have to go in and out of prison quite often to have their scans and their appointments. Sometimes they would be in handcuffs attending antenatal clinics, and sometimes they would be with prison officers, and they would feel like the public were looking at them as if they were monsters. And I think what I've mentioned as well is the fear of separation. So pregnant women, when they're in prison, it's not an automatic given that they're going to be able to keep their baby with them. And that's something that they have to go through and apply for to try and gain a place on a mother and baby unit. And we've got 6 mother and baby units in this country. And there are enough places, but often the situation is that they don't know until quite late on in their pregnancy that they're going to have their baby with them. So that's quite a worrying and very stressful situation for women. One woman in my research had actually given birth in her cell, and it was obviously a massive trauma. But there are more serious issues at play where we're thinking about the dangers maybe to pregnant women and their unborn babies, which we tragically saw with the death of baby Aisha Cleary, where the inquest was recently reported on.
Yeah, Jason, I'll bring you in at this point because you can tell us about the case of Aisha Cleary, because the worst case scenario for women given birth in prison is the death of mother or child. In recent years, 2 babies have died in women's prisons. Laura there was referring to young Aisha Cleary. Talk to us about what happened in this instance.
Well, I think Aisha's death was a real wake-up call, because here was a young woman, she was 18, she was vulnerable, she was pregnant, she was locked in her cell. Obviously a very worrying time for her. She goes into labour, rings the bell and says she wants medical assistance, and she doesn't get a response. And that remains the case throughout the entire evening for 12 hours until she is discovered unconscious and the baby dead in her cell. She's even tried to cut the umbilical cord with her teeth. It's an appalling, horrific scenario. We will never know whether that baby could have been saved if she'd have had the medical attention she needed. And there was an inquest into that found that, more should have been done and there were mistakes made. But it does also just raise, well, even if someone had, this is a woman who you've got to get the keys, you've got to get the medical attention, you've got to get the ambulance into the prison, that all takes time. So even if there had been a response, being in prison itself is a risk. And that's what the Ombudsman actually found when it investigated this in 2022. It said all pregnancies in prison should be treated as high risk by virtue of the fact that the woman is locked behind a door for a significant amount of time.
As it stands, when sentencing, judges are asked to take pregnancy into consideration. Actually, the wording is they may consider. So they actually don't have to legally. So how is this working in practice?
There's not a specific thing in the guidance that says, other than under dependencies, and then a subclause of that is pregnancy, where it says you may consider pregnancy, essentially. So it's not a statutory obligation. I've spoken to some people who are barristers who say, well, of course, the judge will always consider it. They will take that into consideration. But I have also spoken to women who say, no, it wasn't brought up. It wasn't even mentioned. And obviously then you get women who discover they're pregnant when they go into prison. But I mean, a lot of campaigners are saying that prison is just not the right place for a pregnant woman. And then the slightly lesser argument is, well, it should at least be a statutory obligation for the judge to consider it.
What are campaigners saying? Because there are stats from the campaign group Level Up who say prison will never be a safe place to be pregnant. That is the fact of the matter. Pregnant women in prison are 7 times more likely to suffer a stillbirth, twice as likely to give birth to a premature child.
That's right. I mean, those thoughts are backed up by the Royal College of Midwives. That 7 times figure comes from an FOI. It's a credible figure. What the Ministry of Justice says is that custody is always the last resort for women, and independent judges already consider mitigating factors like pregnancy when making sentencing decisions. They say we've made significant improvements to the support available for pregnant women in custody in recent years. This includes employing specialist mother and baby liaison officers in every women's prison, conducting additional welfare checks and stepping up screening and social services support so that pregnant prisoners get the care they need. I spoke to an MP today who said, well, look, you can see the headlines, used to be woman gets pregnant to get council house. Now it'll be woman gets pregnant to avoid prison. You can say, another minister said to me, gangs will use this to exploit women. They'll get them pregnant, that sort of thing. And you can see people saying this shouldn't be used to avoid punishment. This shouldn't be a way of. So we should mention there is a difficult counter argument here, counterbalance about justice being done and being seen to be done.
Laura, does that argument ring true with you? Because regardless of the situation within which a woman falls pregnant and goes into prison, they are still vulnerable. And, looking at your research and Jason's report, the level of care has been described as substandard, which might, feel like quite a conservative word to use. And it just comes back to that question, Laura, do you think prison is a safe place to be pregnant?
I think, when we look at all the evidence, I would say it's not a safe place to be pregnant. And we know that there are 11 other countries that we know of that don't imprison pregnant women. And we know that, there are alternatives which do work. And I think as well, it's thinking about the reasons why a lot of women end up in prison in the first place. It's often crimes of poverty, crimes of survival, those sorts of situations where women may be pregnant and homeless. We know of a case recently where a woman was 36 weeks pregnant and homeless and sentenced. And the evidence really does show that we need to consider alternatives for women, and they are out there and they do work. And if we tackle those causes, we may eventually end up with less reoffending in the first place.
The Sentencing Council is going to make a decision on the sentencing of pregnant women. It's the consultation period at the moment. And this, in effect, could see new guidance for judges. Explain to us the process and what we're expecting.
Yeah, there's a consultation process. People can submit their thoughts and, there have been letters written making the arguments that have been made here today. I mean, there are some things that are out of their scope. So, for example, one question is women on remand. Should they spend their time in remand, in prison, or should they always be bailed if they're pregnant? That doesn't come under the Sentencing Council's review. But I think people would like to see proper guidance from the Sentencing Council to judges, a statutory obligation to see pregnancy as a mitigating factor.
Well, Laura, as Jason said, that this decision by the Sentencing Council won't solve the problem, but it may well in part tackle some of it. What changes do you want to see?
I'd like to see that women's centres utilised more widely. We have some brilliant women's centres in this country, and I'd like to see more. And with that, we can start tackling some of the causes of sort of incarceration in the first place, things like domestic violence, things like abuse in childhood, and all sorts of areas where women may have been victims themselves. And I think if we can tackle that and have good alternatives to imprisonment, then we're going to be able to see less pregnant women and less women in prison in the first place.
Jason Farrell, our home editor, and Laura Abbott, midwife and academic. Thank you. Shortly, I'm going to be speaking to another expert about the impact prison has on babies and other challenges of women's healthcare in prisons.
There's huge efforts within prisons to provide the very best care possible in that environment.
I'm joined now by Kirsty Kitchen from Birth Companions. They work with pregnant women in prisons to make sure women's voices are heard by the outside world.
It's really, really important that we don't just focus on the point of giving birth. Actually, that's when, in the vast majority of cases, a woman gets out, gets to the hospital that is local to that prison, and gets, quite a lot of care and support. Actually, the biggest inequalities and the biggest risks can occur in pregnancy and in that critical postnatal period where there's a really huge risk of harm to the mother or the baby because of pregnancy complications, miscarriage, stillbirth, but also postnatally infection, hemorrhage. So that's why it's so important that we don't just fixate on the point of birth, that we think much more widely.
It sounds like it can be a really isolated and extremely worrying time, and pregnancy can be fragile, it can be complicated, it's individual to every woman. Is it fair to say that prisons just don't have the resource to cope with pregnancy within its walls?
It also goes much further than just thinking about the resources that are available, actually. there have been efforts to put more resources in place in prisons for pregnant women and mothers of infants, whether or not those babies are with them in their care while they're in prison. The amount of attention and resource has gone up. It hasn't fixed the problems, though, because it's not only the resource, it's the whole nature of that system. It is not a system that is designed around providing safe, compassionate, continuous healthcare in the way that we know women need in the pregnancy, birth and postnatal period. It is a system designed around control and punishment. It's just never going to be an appropriate space for women at that really critical point in their lives and also the lives of their children.
We've talked about the effect on mothers, but what about the impact on the baby?
The risks to a baby before birth of pregnancy complications and concerns not being addressed quickly and by the right professionals are obviously huge. Also, the risks of so much trauma and anxiety and fear and a lack of control for a pregnant woman is shown to have an impact on her unborn baby. People talk about the 1,001 critical days that start from the point of conception right up to a child's second birthday as being completely formative in terms of long-term outcomes for that child, their cognitive abilities, their ability to cope with stress, their emotional and physical well-being. So we can't underestimate the impacts on those babies before birth and afterwards. And a lot of babies are separated from their mother when their mother goes into prison or after their mother gives birth during time in prison. And the impact of that separation at such a crucial point is huge.
Let's talk about remand. Many of the problems aren't experienced by convicted criminals, but people on remand. Talk to me about why this is a particular problem.
It's an increasing and very significant part of the population in the women's prison system. So these are women who enter prison custody while they are awaiting sentencing, effectively. So they haven't had bail or they haven't applied for bail, and they're spending time in their cells while they wait for that sentencing to happen. We know that the data shows that over half of women who are remanded to prison by the magistrates' courts go on not to receive a custodial sentence when they are sentenced. And so we have to get to grips with that issue. It doesn't affect only pregnant women and mothers of babies. Obviously, it's an issue across the women's prison system, but it has to be tackled, because otherwise all we're doing is heaping trauma on top of trauma for women.
Kirsty, do you think there's a bigger question to be asked about women's healthcare in the prison system? Because women have different healthcare needs to men. Does this need to be looked at more broadly, not just focusing on the small number of pregnant women in the system?
Absolutely. Pregnancy, the postnatal period, they're part of a much wider set of issues. They're part of a wider set of sexual and reproductive health needs, but they're also part of the women's health picture more generally. Unfortunately, we've been waiting for 18 months or so now for the publication of a huge review across the women's prison estate that was conducted in partnership by the NHS and His Majesty's Prison and Probation Service, as it is now. And that was a whole scale review, the first of its kind, looking at the health and social care experiences and needs of women in prison. It hasn't been published, but it is a fundamental question that we need to ask. What are the health outcomes for women in prison? What are their needs? How adequately are they being addressed, and what more has to be done?
Kirsty Kitchen from Birth Companions, thank you. That's all for this episode of the Sky News Daily podcast. You can watch Jason's full report on the UK Tonight. That's 8 o'clock on Sky News. Do join me then, and every week, Monday to Thursday. Next time, our political presenter, Sophie Ridge, will be with you. Thanks for listening.